Well, good afternoon, everybody. It is rare that I would be here at the 1:30 briefing, but in daily conversation with Dr. Morrison leading up to the release of our COVID-19 projection modeling, we both felt it was important for me to be here. Before I hand it over to Dr. Morrison, I would like to make a couple of important points. The modeling that we're releasing today, the modeling that you will see, like all models, is imperfect. And it is just one of the many tools that we use to inform our public health response. The numbers within, some of which may be sobering to some, demonstrate just how serious this pandemic is and why we have been working so hard, so smartly together to put measures in place to mitigate and contain the spread. Models, this one included, make a lot of assumptions, but they are also built on data, up-to-date and very real information. These projections will not only show where we were and where we could have gone without putting in place important measures, but also where we can and could go if we let our guard down too fast. I am proud that as a province, under the leadership of Dr. Morrison and her staff, with the full cooperation and buy-in of Islanders, that we have been doing as well as we have. The measures that we put in place early, much earlier than many, are paying off. P.E.I. has been a leader when it comes to limiting interprovincial travel, when it comes to self-isolations and social distancing, and we acted very early and swiftly as it pertains to the protection of our most vulnerable populations, such as those living in long-term and community care. And while we have been doing well, by no means are we finished. I'm a hockey guy at heart, so to use a hockey example, we're winning. But it's only the end of the first period, and there's lots of work left to be done, and they don't hand out the trophies after the first period. While saying that, I do understand what Islanders are feeling. I understand that every single Islander has been impacted, and that we are really, really eager to get back to some kind of normal, whatever that new normal may be. I certainly want that. I know Dr. Morrison wants that. We all want that. I have spoken for the past several days with Dr. Morrison about some kind of smart ease back. What are some of the things that we can do to relax, if ever so slightly, so that we can begin the process to get back to some kind of gradual, safe transition to whatever that new normal would be. We haven't been able to put a firm date on when that will be, but we know at some point soon, hopefully soon, that can begin. Our government will continue to work with the Chief Public Health Office, with Health P.E.I., with industries, businesses, and organizations in the coming days and weeks to develop potential scenarios for an ease back of operations. For now, what we know is that it won't be today and it won't be tomorrow, but we really, really want that to be soon. We know that we need to continue to adhere to the advice and direction of Dr. Morrison and the CPHO. We have been successful to date as a province because we have been taking an island approach by being in this together, and we need to continue that approach. I'm very proud of the measures that we've put in place and the cooperation we have had from all Islanders. And I know it hasn't been easy. It's taken a toll on all of us, and there have been consequences to our actions. We know that, and we talk about it daily, from a health, from a social, from an economic, and a community perspective. We know there have been impacts, but we must remember that the measures that we have taken, the commitment to following the advice of Dr. Morrison, is all in the name of reducing illness and saving lives in this province. And as we move more gradually at some point soon towards a smart ease back, it's important that we follow that same advice with the very same level of vigilance and buy-in that we've had for the last 4 weeks. What I need Islanders to know is that we're paying attention to your concerns and your needs. Your health needs will always come first when it pertains to COVID-19 and our response. But we know that collectively as Islanders, we have other needs that need to be considered, such as social, economic, community, education, and so many more. These all form part of our overall well-being of each and every one of us. And I want you to know that we are taking those needs and those desires seriously, and when it is safe to do so, we will be ready to start the transition. We are in this together. We can't do this alone. Dr. Morrison can't do this alone. I can't do it alone. But we must continue to band together and act as Islanders to see this safely through. So with that, I will turn it over to Dr. Morrison for her joint daily update health brief, as well as our COVID-19 modeling projections.
Thank you, Premier. Good afternoon. I think the focus really today is on the modeling, and as I go through, I will be giving an update of our situation here in Prince Edward Island. I'd like to start by saying and echoing the Premier's comments that we are in this together, and what we'll see in the next few slides just reinforces that we've been in it together and we will continue to be in it together. The modeling has been put together with a really great expert group of modelers from the Atlantic Vet College, epidemiologists from the Health Information Unit at Health P.E.I, outside of government as well, or outside our office in other parts of government as well as within our office. Really, we're very fortunate to have this very expert group of modelers. So models are just one of many tools to inform a public health response. It can guide responses, but it is very sensitive, certainly, to the numbers that we see as we go forward. Today is really an assessment of our current status of COVID-19 epidemic in Prince Edward Island, and to look at some of what these models and the outcomes could be with different public health intervention scenarios. We recognize that models are imperfect, and as I mentioned, it's just one of many tools. We know around the world there have been more than 1.9 million confirmed cases of COVID-19 and over 120,000 deaths. And across Canada, there have been more than 25,000 cases of COVID-19 and more than 780 deaths. While there are no new positive cases to announce for today, I would like to mention again that 23 of the 25 cases are considered recovered, and we have close to 2,000 tests done here in Prince Edward Island. Those testing numbers are putting us at P.E.I. in terms of our population testing numbers just above the Canadian average. Across the country, hospitalizations are about 19% of the cases that occur in the country, and of those hospitalized, 28% are in the ICU. And our modeling numbers do also take into account these hospitalizations that occur in the rest of the country. P.E.I. has fared better than many other provinces and territories, and that's many thanks to people who are listening and those who aren't, in terms of your behaviors and your adherence to the public health measures. And although it may be difficult for some to see, we are on a green line, which means our cumulative diagnosed cases per 100,000 population certainly is lower than many other provinces and territories. The next slide really just is an outline of our key public health measures timeline in terms of when certain measures were introduced. For instance, on March 13th, international travelers were told to self-isolate for 14 days and we advised canceling non-essential travel. On March the 21st, public health orders were issued for screening at points of entry and for self-isolation after out-of-province travel. And as we look forward, in terms of P.E.I.'s approach to modeling, they are not crystal balls to predict what will happen, but they can help us understand what might happen. And they can give us a picture of what could happen, and this will help us plan. And it's a way also to communicate. We are using what we call a compartmental model to project how the epidemic may unfold, and it uses data from other countries, Canada and P.E.I. to model the spread of COVID-19 in P.E.I. And it creates scenarios using a range of data values. And scenarios are created to better understand what may be required to control the epidemic, reducing the number of people a person infects to less than 1. So we have borrowed one of the slides that was made public from the Public Health Agency of Canada, because I think it shows a description of visually of what we're trying to achieve. So if each person infects fewer than 1 person on average, the epidemic will die out, and that's what our goal is. Our estimated Canadian R naught, and so that's how many people someone would infect. So prior to stronger public health measures in Canada, it would be 2.2, and our goal for Canadian R naught for the epidemic to die out would be less than 1, and we would have that same goal here in Prince Edward Island. So we have focused on 2 scenarios, one with mild controlled measures and one with strong control measures. So mild controlled measures would be, we might identify a high proportion of cases, which would be isolated, but we'd have a low degree of physical distancing, a low proportion of contacts who would be traced and quarantined, and a low proportion of self-isolation by out-of-province travelers. And then the other scenario is where we have strong control measures. And that would mean we have a high degree of social or physical distancing, a high proportion of cases identified and isolated, a high proportion of contacts traced and quarantined, and a high proportion of self-isolation by out-of-province travelers. And that is what we are having right now, a very strong control measures in Prince Edward Island. And if there is good adherence, 1 more person is infected for each case, as opposed to in mild control measures where 2 people would be infected. The outcomes that are presented today are for the first 80 days of the epidemic in P.E.I. from our first case identified on March the 14th. And the projected total patients admitted into hospital for the mild control scenario is more than 100 times larger than that for the strong control scenario. And the highest projected acute care bed needs per day for the mild control scenario is more than 200 times larger than that for the strong control scenario. And because our COVID-19 status over the last month has remained stable, and there have been really the travel-related cases, no hospitalizations, and no fatalities, if we decided today to release the public health control measures to be like a mild control scenario, the projected curve would look the same as what you see on the screen as the blue curve for the next 80 days. The dotted line across the bottom represents the current available acute care beds in our province, which is at 207. So as soon as we get above that dotted line, that is when we exceed our capacity. But we right now are having such good, strong control measures that we are well below that dotted line. As soon as we go above, that's when we exceed the capacity in this province. And that's with mild control measures very quickly accelerating. Our critical care bed needs for COVID-19 by June the 1st, again, starting on March the 14th when we had our first case. And the highest bed needs for the mild control scenario is more than 200 times larger than that for the strong control scenario. If only mild control had been put in place when we had our first case, so we hadn't implemented these public health measures, it's possible that the critical care beds that we have in this province would be full by today. But because our status has remained, over the last month, has remained very stable, and as again, the travel-related cases, no hospitalizations or fatalities, we're in a good position. But if we were to let go, again, of all our public health measures, it would look, the curve would continue for the next 80 days. And really if we let go today of all our measures, by mid-May, we would exceed our capacity for critical care beds here in Prince Edward Island. The projected total fatalities from COVID-19 for the mild control scenario is 100 times larger than that for the strong control scenario. And in many ways, the numbers are less important than knowing the degree of what it shows us if we do not have public health measures in place and what would have happened if we didn't start them when we did. Another slide which shows again the cumulative fatalities from COVID-19 by June the 1st. For the mild control scenario, again, much larger than for the strong control scenario. And again, if we decided today to release the public health control measures to be like the mild control scenario, the projected curve would look like the same blue curve from here for the next 80 days. Our actions have made a difference as islanders. And I think if there was one message I would like people to realize, it would be that. We are still in an early phase of the epidemic, and as such, we do have an opportunity to control the remaining part of this epidemic. We know what public health measures are required. Physical distancing, we have talked about it at length, self-isolation about its importance, testing to find cases, rapid tracing of contacts. The next phases in this model, the next steps, would be to assess scenarios for modifying these public health measures and or testing strategies to control the epidemic without overwhelming our health capacity. When I asked others what they thought of this model initially, I heard different responses. One, this is motivating and reassuring. Motivating that we have been doing the right measures, and motivating that we need to continue to do so. It's also reassuring that our actions have made a difference. These are powerful models in many ways because it shows us what could have happened, what will happen if we don't do some degree of public health measures going forward, and it puts it in perspective. What we will do in the weeks ahead will also make a difference. I certainly don't want us to risk what we've accomplished to date by going too quickly to ease up. But I know, as the Premier mentioned, we all are looking forward to that process. If we do nothing, it will be a lot worse. But it will be better for us if, as a community, as a province, if we continue to work on these public health measures and help our health system and make sure it has a chance to manage in terms of its beds and its ICU capacity. Modeling is a challenge, certainly, in a province of our size, and we do this with a delicate balance going forward. But I will say we will continue to come back every couple of weeks to update these models, reflecting what our current status is and what we can learn as we do more dynamic modeling in different scenarios. Alors, juste quelques mots en français avant les questions. À travers le monde, il y a presque 2 millions de cas et plus de 120 000 morts. Au Canada, il y a plus de 25 000 cas positifs et presque 800 morts. Il n'y en a pas de nouveaux cas à annoncer, heureusement, ici à l'île du Prince-Édouard. Et 23 des 25 cas sont considérés comme rétablis. Ça fait toute la différence ce que nous faisons. Et nous devons continuer pour que nous puissions continuer le combat contre le COVID-19. Je vous présente aujourd'hui la modélisation de notre province. La modélisation n'est pas une boule de cristal qui va garantir notre avenir. Ça nous donne un portrait de ce qui est possible pour notre planification. Alors, je ne vais pas tout répéter en français, mais je vais ouvrir pour les questions. So, over for questions.
Okay, well, thank you very much, Heather, and thanks for your wonderful work as always. Your leadership on this from a health perspective is certainly respected and admired by Islanders, and count me among those as well. So thanks for your work, and I think now we will turn it over to some questions from the members of our media. So,
Nicole Williams, CBC.
Hi there. This question is for Dr. Morrison. From the slides, I don't see a prediction for the total number of cases. So I know you went into hospitalizations, the number of deaths, but what do you suppose the total number of just infected will be on P.E.I. with strong measures?
So good question, and I think some of the models across the country have looked at infections versus actual cases, which is different in different places. We focused not on our actual cases who would end up in hospital. I don't have the numbers in front of me about the presumed cases, but it's certainly we know that about in the country, as I mentioned earlier, 19% of the cases in the country are being hospitalized. But that's exactly the kind of information that, without any hospitalizations, it's going to be difficult in some ways for Prince Edward Island. So every couple of weeks when we come back, that will be reflected and updated, and we can certainly include that on the next our actual cases, and not just in hospital beds on the next round. That would be a good thing to include.
Thank you. And my next question is about on the slides it shows that even with controlled measures, you're predicting that there could be at least 9 deaths and 120 people in hospital. What do you make of those figures, and how does it inform or change the way you're preparing the public health response?
Well, I mean, if I had a choice, I'd hope that there would be no one in hospital and no deaths, and I still can hope for that. When I look at those numbers, it is really, are we going to be able to manage as a system in terms of our critical care beds and our acute care beds? And are we going to be able to manage the volume and the number of people who could get sick in this province? So, and I think in terms of the 120, if that is spread out over a period of time, our system would still be able to manage that. What we cannot manage are hundreds of cases a day who require a hospital bed. And it's to manage that. And so right now, if based on what we have been doing, our system has been managing and would continue to manage, but it's how quickly it could change as well if we had a long-term care outbreak. And that's why in many places modeling is so challenging, because one outbreak with a number of hospitalizations and deaths would be dramatic in any province as well as here.
Brittany Spencer, CBC. Hi, my question is for Dr. Morrison. Previously, Premier King mentioned that discussions were starting to take place about what easing back might look like. And I know it's early on in those discussions, but as you're having them, what are some of the first steps you imagine the province taking as that easing back process starts?
Well, I think we're asking ourselves the same kind of question. I think right now, based on what our cases to date, some of our biggest risk is in importation of cases. So we certainly know at this point in time, we would not be wanting to ease up at our points of entry, for instance. So that would not be where we would go to first. But I think it is partly will be helped by some of the models, this dynamic modeling as we go forward to see what we could do that will allow some of the measures to be lifted a little bit. Some of them will be lifted if people can certainly continue to have physical distancing, for instance. But it's, so I don't think I can say yet what ones go first, but it will be an ongoing discussion. And equally with that is how do we make sure the infrastructure's in place to do good monitoring so that we can detect any increase in cases as things may ease up, and it's almost what we call a sentinel surveillance, so really early indication that anything is happening. And as I said, we certainly don't want to take a step backwards and try to catch up, because that will be really, really difficult in this province.
Okay, and my follow-up question, you mentioned there, wanting to avoid any importation of cases and wanting to sort of stay the course that we're on. So my question is about, it's the time of year when a lot of people are coming from other provinces to open up their cottages or spend the season on P.E.I. Will those people coming to the island be turned back at the bridge and the airport?
So we are having certainly discussions ongoing, and premiers certainly feel free to jump in here, but about what we may be able to do to tighten up some of those measures. As you know, we're doing screening at our points of entry, and we would do so the same at the ferry, and we would be making sure people self-isolate. But what are there other further measures we can do to strengthen those points of entry? So the discussion is very active, and we will be probably having more to say about that shortly.
Yeah, I don't think I could add much more to that other than obviously anything we would look at first would look at moving around Prince Edward Island a little bit more freely than we have been without compromising the entry points, as Dr. Morrison has talked about. In terms of whether we turn people away, I think we've been trying really, really hard to talk about the essential need to come, but if you are here, the need to self-isolate, which I'm very proud as a province we've been really, really strong at, and I think British Columbia has started to follow our lead on this, is that when you're here, you come and self-isolate. We have a contact with you at a very least daily to make sure that you're self-isolating, to make sure that we can help you if you need things. And I think that would need to continue for sure in terms of how we approach that. But as Dr. Morrison has said, I mean, these are very preliminary discussions to deal with an issue that we've never had to deal with before. So we don't have all the answers yet, but we're working together to try to find them.
Thank you very much. Rachel Collier, Eastern Graphic.
Hello? Hello? Hello?
Hi.
Sorry about that. I have a question that might be best answered by Mr. King there. I'm wondering, what is the screening process for foreign workers upon their arrival? And what requirements are going to be made of ensuring their safety once they arrive?
Well, look, temporary foreign workers, as Minister Myers talked about last week and Dr. Morrison has talked about a little bit, obviously a federally regulated system. We, in any other year, wouldn't have much challenge with this, but I did express to the Prime Minister on a number of occasions that it might not be a need this year for temporary foreign workers, strictly because we have about 11,000 islanders unemployed, and we are concerned about the importation of COVID, as Dr. Morrison has talked about. So we couldn't direct the federal government not to have temporary foreign workers here, and we do recognize that individual companies have created the need for an assistance to the workforce. What we can control here as a province is the self-isolation of those who travel here. So we have made some hotels available, and we've directed those companies who are utilizing the temporary foreign worker program this year to let them know that each individual employee will need to self-isolate in those hotels for 14 days until such time as they can go to perform the work at their locations. So that's what we have undertaken, and we're very happy that the federal government will reimburse companies on P.E.I. for the cost of that.
Okay. And do you have any sense then of how many temporary foreign workers might be set to arrive, or
look,
year?
Sorry, Rachel, in a normal year, it's usually about 600 to 700, I believe, in that range. It won't be that many this year, obviously, because there's still some uncertainty around the lobster season for sure, and all things seem to be a little bit later here. The numbers I saw for April, Heather, were somewhere about in the 100 range, but I think that was a high-end estimate at this point. But it will be significantly less than in other years, but there are some companies in Prince Edward Island who have indicated they would be wanting to utilize the temporary foreign worker program this year.
Okay, thank you.
Thank you.
Stu Neepy, The Guardian.
Hi, good afternoon to you both. So I guess a question for Dr. Morrison about the modeling. Just wondering a little bit about the timeline for when they were completed. And have these models actually sort of guided many of the key public health decisions up to now, like social distancing or testing policies, or should we look at them as sort of estimates to guide decisions going forward?
Hi, Stu. I think actually it will be more to guide the decisions going forward, but remembering what we talked about, that they are not crystal balls, and it's not what will happen, but what could happen. I think one of the benefits of doing the modeling and putting it as a start date really from the time when we had our first case on March the 14th is it does allow us to look at what's happened in the last month and how effective it has been in reducing the number of cases here in Prince Edward Island and the impacts to the island. So it has we didn't have it to guide all the measures we put in place in middle of March, but it's certainly, as one of our team said, it's certainly reassuring and at the same time motivating that it reflects, this modeling reflects that.
Okay, and I guess just as a follow-up, Dr. Morrison, I mean, in other provinces, they've sort of had like the 3 columns, where one of them is the more dire column where, if no measures were taken, usually, of course, the number of hospitalizations and mortalities are quite a bit higher. Doesn't seem to be there in these models, so why exclude the sort of, if no public health measures were taken sort of column?
Well, I think what you're talking about is sort of having a middle column, and it may be something we do in future models. I think for this first model, and when they look at compartmentalizing the different assumptions that go into the model, it's I think if you get into too many sort of columns, especially with our smaller numbers, I think that created its own challenges when we looked at it the first time, but we certainly will be continuing to look at it and what happens. And in some ways, that middle column is where we start to run different scenarios of what moderate public health measure adherence might look like, and but easily can get above what our critical care beds and our hospital admission beds would tolerate.
Okay, thank you.
Thank you, Stu.
Carrie Wynn, Ocean 100.
Hello. My first question would be for Dr. Morrison. Just in regards to the long-term care facilities. You know, we've seen across the country, you know, many sad incidents that have been happening and a number of deaths there. Now, the Public Health Agency of Canada issuing those 7 recommendations to kind of complement or go along with the territorial or the provincial health efforts. So I'm just wondering about those recommendations that they have made. Will Health P.E.I. will be implementing all those, some of those, or how will that work?
Well, we've looked at those recommendations from the Public Health Agency of Canada, and I think it was important to do that actually because we are updating our outbreak management guidance around long-term care. It is being actually making sure that those national guidance was incorporated into our own provincial guidance here as well. And we expect that document in discussions with Health P.E.I. even this afternoon to then be distributed and made available. And I think some of the recommendations, I think, have already been in place in terms of very tight visitor restrictions and closing homes to visitors. I think wherever possible, I know there's been discussions with the health system, both public and private, around what kind of impact it would have if you limit mobility of staff as much as possible between facilities. Making sure that residents and staff are monitored closely for health symptoms, and then of course recommendations around PPE for facilities and both acute and long-term care, private and public. I think all those things are going to be important, and it is absolutely tragic when you look at what has happened in some of the long-term care facilities across the country. And I think I mentioned yesterday, it remains a concern for everyone who is involved in long-term care and for every one of us who may know people in long-term care, who have loved ones in long-term care. And it certainly is a big concern for me and our team. And I think I mentioned earlier that it would only take one outbreak at a facility to significantly change what COVID-19 looks like and feels like here in Prince Edward Island.
And just within those recommendations, Dr. Morrison, I know one of them was the wearing of masks for all staff, essential volunteers and visitors. Is that going to put like an extra load or an extra worry on Health P.E.I. Looking for those extra masks so all those long-term care employees, et cetera, have that personal protection equipment?
Well, I think they're in the process of looking at their PPE and trying to get it out and rolling it out in discussions with the long-term care facilities. It is a priority for them, and this week is certainly getting information out, not only information out, but actually PPE being rolled out to the different facilities, I know is happening as the week goes on and will be really important.
Thanks so much.
Great. Thank you, Carolyn.
Laurent Lavoie.
Oui, bonjour, Dr Morrison. J'avais une question sur le modèle. Dans le cas des mesures fortes comme on est aujourd'hui, est-ce que vous supposez qu'il y aura de la transmission communautaire un petit peu quand même?
Est-ce que je pense qu'il y aura de la transmission communautaire maintenant ou
dans le cas de mesures de contrôle fortes, vous dites qu'il pourrait y avoir 9 décès au 1er juin. Est-ce que ces 9 décès, ce sont des cas importés ou est-ce que c'est dû à une faible transmission communautaire?
C'est peut-être une faible transmission ou des cas importés. On ne sait pas, on n'a pas vu la transmission communautaire à ce moment. Et puis, le risque est vraiment d'être les cas qui viennent d'ailleurs. Mais c'est toujours possible depuis maintenant et juin qu'on a des cas communautaires. Et puis, si on en voit, j'espère qu'on peut les isoler très vite et faire les contacts et les suivre très vite. Et puis c'est pour cette raison encore qu'on va refaire la modélisation dans les presque chaque 2 semaines pour être plus certain de qu'est-ce qu'on voit à ce moment.
Et juste un suivi sur cette question. Est-ce que vous avez parlé rapidement du relâchement des mesures peut-être dans les semaines à venir, tout doucement? Est-ce que ce relâchement des mesures, il est compatible avec le scénario des mesures fortes?
Le relâchement serait... c'est une balance délicate, je pense, parce que si on fait le relâchement trop vite et trop grand, on va augmenter plus que le système de santé on n'a pas assez de lits si on augmente trop vite. Alors, le relâchement doit être fait un peu un pas par un pas, je pense, et pour être certain qu'on n'augmente pas trop vite.
Merci.
Okay, merci. I'll just repeat it in English. So the question really around, as we go forward, are our numbers that we're seeing based on just importation or community spread? And it's a good question. I think it may be a little bit of both, but and if it is community spread, we hope we can limit that by doing really good case identification, contact tracing, and isolation of the cases and the contacts. Another reason that we would want to continue to look at these models on a regular basis so we can update that in case that changes in terms of what we see in terms of importation versus community transmission. And sort of the question I think I may have answered already in English, but the next question about if we release, if we talk about release, is it possible that if we release too quickly and too much, we'll go above what our health system can tolerate? And that will be the case. And it certainly means for me we have to be careful on how we go forward. Premier mentioned we're all anxious to have some release of our public health measures, but it would. We certainly don't want to go too quickly and do that. But all the provinces are talking about it. They're talking about it in different parts of the world. What can it look like, and how can we do it safely with the health and safety of all islanders, tous les insulaires, in mind.
François, Radio-Canada.
Bonjour, Dr. Morrison. Vous l'avez abordé un peu en anglais, mais j'aimerais que vous répétiez en français quelles seraient les conséquences de relâcher immédiatement, avec les projections que vous faites là, quelles seraient les conséquences de tout relâcher immédiatement, les mesures qui sont en place?
Les conséquences immédiatement, si on fait le relâchement en tout, on aurait vraiment, avant le mi-mai, on n'aurait pas assez de lits à l'île du Prince-Édouard pour les personnes qui doivent aller à l'hôpital. Même dans même bout de temps, on n'aurait pas assez de lits pour les personnes qui sont très malades ou qui ont besoin de soins intensifs. Et puis, je suis peur qu'ils vont tous les résultats qu'on a eus jusqu'à date, on perdrait tout si on les lâche tout de suite comme ça.
Question for Premier King, if I may, as a follow-up. Good afternoon, Premier. You mentioned getting back to the new normal. Do you have a sense of what that new normal may look like at this point?
I think, quite honestly, if we had $1 for every time Heather and I were asked this question, either by email, text, or through the media, we would be doing very well. I can make a stab at it just in terms of what I think the new normal would be. Obviously, we wouldn't be relaxing the entry points of the province, but I mean, the questions are, can we find a way for, some activity, whether it's in the retail sector, to operate at a minimal capacity? Can people move around a little bit more freely while exercising social distancing? Can the tether be a little bit longer, type of thing? I get asked questions like Dr. Morrison does from my kids. Are we going to be able to play baseball this season, for example? And I certainly hope there's baseball in some way, shape, or form this summer. I don't know how it looks. I think we actually talked about a soccer game without huddling or something like that. These are the very early stages of conversations that we have. I do think the realization we all have is the new normal, whatever that is going to be drastically different from what we would be preparing to do this time last year or any other year. So it will be a modified type of living at its very best, I think, Dr. Morrison. But we're still a piece away from that, and it's important to know that. We need to be ready for whenever that conversation can be held, and we can look at relaxing, but as we said, it's not today and it's not tomorrow. But what it looks like, I dream, I know that, but Doctor, you might have something to add to it. But
Thank you.
Thank you, François.
Julien, Radio-Canada.
Bonjour, Dr. Morrison. Première question pour vous. Par rapport au modèle que vous avez présenté, 9 morts dans le meilleur des cas au mois de juin. Estimez-vous que depuis un mois, depuis le début de la crise, vous avez évité le scénario catastrophe et finalement ce qu'il se passe aujourd'hui avec 0 hospitalisation, 0 mort, c'est un scénario que vous n'aviez même pas envisagé?
Je pense qu'on a fait, depuis le mi-mars, on a fait, j'ai imaginé qu'on aura eu des hospitalisations et les morts déjà. Alors, c'est pour cette raison je suis tellement content de tout ce que les insulaires ont fait ici avec les mesures publiques qui ont beaucoup changé leur vie. Et j'espère que peut-être le 1er juin, on n'a pas de mort ici. Mais et c'est moins à propos des numéros, mais quand regarde la grande différence entre qu'est-ce qu'on voit si on met les mesures qui sont fortes en place et puis les mesures qui sont tellement moins fortes en place. C'est la différence entre les deux qu'on peut voir en regardant la modélisation.
A follow-up for you, Premier. Premier, we are maybe around 1 month after the beginning of the crisis. How you can evaluate your job since the past month? You were, we can say, one of the leaders in Canada about all of the measures that you put in place in the province to protect the islanders. But do you think that you could do better, or you are pretty proud about all of the decisions you took during the past month?
Well, I think I would answer yes to both components of that. I think in many regards, I'm very, very proud of the leadership that we have shown as a province. But all of that direction comes from Dr. Morrison and her staff. They have been leading the health charge on this, and I hope if there's one thing that I have brought to the table as the Premier is that ability to listen, to delegate, to rely on the experts who do this. Dr. Morrison, along with being a tremendous media personality, is probably one of the smartest, if not smartest, people that I've ever been around. So it's easy for me to take her advice because I know it comes from a place that is well researched and it is very thorough. Look, do I think we could have done better? I mean, yes, I think every day we probably look and say we wish we could have done this or that. I'm very grateful and appreciative of the fact that we have to date limited cases, no hospitalization and no deaths. I feel very, very fortunate that we're in this position, but that comes from a place of really, really hard work, really, really good planning, perhaps a little bit of good luck. But I feel through the leadership of Dr. Morrison and all of the health professionals that we've been ready for every aspect of this and we've acted as swiftly as we possibly could.
Thank you.
Thank you, merci. Well, thank you very much. And just before I go, I would again say thank you to our members of the media. You do an incredible job of keeping Islanders informed, and you're doing it like the rest of us are under very difficult circumstances. So thank you very much, and keep up the good work.